minute session of panel discussion. We have our moderator and our panelists, all of whom will be introduced at the point when we get into that session within the country and within the region. Then what happens is with that development, with the strong internet connectivity, other sectors will do a 10-minute question and answer session. Please remember, you don't have to wait for this 10 minutes. Feel free to keep capturing your questions on the chat button, on the Q&A button, so that we're able to start opening up or responding to them as soon as we're able to finish on the discussion side. Then we hope to end the webinar at about 4:20 for the team in Singapore, which will be about 11:20 for the team here within the East African region. So allow me to just give, like I mentioned, just give some level of context around the East African region, who they are, just a general overview of the East African region. We usually look at these two as two main blocks, largely because they both have their strong dynamism, strong differentiations between these two main blocks. One of them is, of course, the East African Cooperation countries. There are 7 countries within that cooperation. This is one of the most integrated bloc, I'd say, within the sub-Saharan region. They actually have, they're already discussing common markets within the East African region, also looking at common currency. So there's a lot of discussions around making it an integrated bloc, which makes it an interesting bloc to look at. Then we also have the Horn of Africa. This speaks of about actually 6 countries. We have Ethiopia, Sudan, Djibouti, Eritrea, Somalia, more on the Horn of Africa side, and so they are more the entry side with regards to the Horn of Africa, but jointly as the East African region, which we in Nairobi look at, would say that it's one of the fastest growing region within the Sub-Saharan Africa side, projected to have a GDP growth of about 5% 2023, against a Sub-Saharan target of 3.5 and the global one at 3%. This region has been largely anchored on agriculture. So we have a lot of coffee, tea, all these cash crops within the region, but we've seen the region gradually diversifying into the services sector, manufacturing, ONG, the healthcare sector. So at this point, I really feel, I'd say I'm a lot of pleasure in introducing our speaker, Mr. Amin Darcy, who will take us through an overview and landscape of the healthcare sector. Mr. Amin Darcy is actually the Regional Director of Purchasing and Supply Chain Management Division of the Aga Khan University and Aga Khan Health Services, East Africa. He holds a Master's in CIPS from UK, a Certified Procurement Operations Specialist from Next Level Purchasing in US, and an MBA in International Business from the Institute of Business Administration, Pakistan. And he has over 22 years working experience in healthcare supply chain in Pakistan, Kenya, and Tanzania. So you can imagine the breadth of and depth of information that Mr. Amin has. So Mr. Amin, I'm going to request you to please unmute, and then I'm exiting the screen share so that you're able to share and take us through your presentation. Karibu Sana.
So thank you very much, Anne. I'm very glad that I'm part of this panelist group. And I'm also glad to connect with some of the colleagues who are healthcare gurus here, Priscilla and Dr. Kochula. We are living in the same country, same city, same field, but we haven't met. So inshallah, after this, I will organize one session for 3 of us to have a cup of tea and see that our struggle, our challenges, our opportunities are the same, how we can collaborate and work together. So in this presentation, I have tried on voluntary basis as much information as I can collect. So please forgive my error or any deviation from 100% fact. I'm sure at 90% it will be the right. But I also want to invite my colleagues, Priscilla and Dr. Kochula, if there is any thing that you think that, I think I need to correct here, feel free to do that. It's all prepared by myself on a voluntary basis. So I will take the group through the overview of East Africa healthcare market from my point of view. So it's again a disclaimer what I mentioned, that this presentation is only for information purpose, not to be copied and be kept confidential. And this presentation has my own analysis, opinion, facts, and gathering and study from the newspaper, from the companies, from the suppliers, whatever I could gather, I tried to put it in this presentation. So this is a fact I just want to present. So global medical tourism is estimated at 40 to 50 billion dollar, and it is growing at the rate of 15% every year. Globally, around 11 million patients travel to other countries for seeking the medical treatment as per 2015, and half of a million patient goes to India alone. As per World Bank statistics, Africa only is losing over $1 billion annually on medical tourism. As Anne mentioned, that East Africa is one bloc which has 13 countries, and East Africa has been a continent fastest growing region, and you could really, when some of you travel to Nairobi, you could really feel it, the quantum of an increase in the economic growth, the dynamism of the people thoughts, the progress that is happening in the East Africa region, especially in Kenya, the mushroom of healthcare region in this country. And so I will focus on three countries: Kenya, Tanzania, and Uganda. As per my analysis, I think the supplier competition is still limited, and this is a supplier-dominated market. You will find in East Africa some of the supplier still are the distributor for 15 to 20 companies for the medical equipment. And some of the distributors are not only the pharmaceutical distributor, but if you are talking about the giant distributor, they are also in pharmaceutical, surgical, medical, IT, and general. They are not only based in Kenya, but they have a presence in Kenya, Tanzania, Uganda, Rwanda, Nigeria, and the same owner has formed different companies. I'm talking about the big giant into the market. So if you are talking about the East Africa market growth, you could see that Kenya in the last few years has seen a big amount of manufacturers entering into this market. And I would quote some of the big name like for healthcare, Johnson & Johnson, Abbott, Roche, GE, Philips, Mindray, getting a Medtronic, which is the biggest medical equipment producer in the world, Boston Scientific, E. Brown, Olympus, Fuji, you name it. They have now all have a in Kenya as a regional hub for East Africa market. So that means there is a need. Companies are looking at this region as this country and this region as a strategic country and strategic region. This market, I feel that still need this. When I'm talking about this market, means East Africa market still need very good backup support, high level of service, regular supplies, and clinical and training, technical training for the clinical staff, technical staff, supply chain staff to the international level. In some of the cases, I will quote the case of Tanzania. Like for example, in Tanzania, there is only one importer for orthopedic implant and cath lab supplies. So imagine the entire country, which has a population of 55 million, there is only one importer for cath lab products. The market is heavily dependent, especially in Tanzania, for the hospitals to directly import, which include urology item, stents, plasma supply, sterilizer, which are very, very common item, endoscopy supplies, nuclear medicine supplies are imported by the hospitals directly in the absence of the importers or distributor. The body which govern the regulations into this country is in Kenya is Pharmacy and Poison Board. Tanzania, it's TMDA, Tanzania Medicine and Medical Device Authority, and Uganda is National Drug Authority. Government has a procurement arm for, obviously there is public and private. So in public sector, in Tanzania, it is MSD, Medical Stores Department, who is responsible for procuring the medical equipment, medical supplies on behalf of government. And in Kenya, it is KEMSA, Kenya Medical Supplies Agency for Kenya. Obviously, there is a good coverage of NHIF, National Insurance Health Insurance Fund, in Kenya and Tanzania for medical treatment, including oncology and dialysis. A little background about Ark Development Network, which I belong to. Ark Development Network has 700 facility in 21 and has 21 hospital in 9 countries, and it provides 9 million people treatment on annually on global basis. In East Africa, we have 4 facilities, 4 hospitals, 170 bed hospital in Tanzania, 300 bed hospital in Nairobi, 140 bed hospital in Kisumu, and 82 bed hospital in Mombasa. In only East Africa, we have 100 outreach centers. We plan to add about 20 to 25 in next 3 years. In Tanzania, we are coming up big time in terms of cancer development, where we are spending 13.3 million euro, and the construction has already started, and we have already acquired Electa cancer radiation therapy machine. We have just added Zanzibar and Dodoma as a medical centers. In Kisumu, we have just opened a few months back a new hospital and spent about $19 million with a capacity of 50 additional beds. In Mombasa, we are expanding with an expansion of $6 million. In Nairobi, again, the plan is to expand our mother and child care services by adding 70 bed, and new community hospital of 50 bed has been planned. In Kampala, again, Uganda, construction has already begun to start 101 bed hospital in first phase. Major player into this market for public and private in Kenya, Tanzania, Uganda. I have tried to summarize the name of key big players. About overall East Africa market, what are the opportunities and changes and analysis that is happening? Life Care Group has, Bliss Healthcare has entered into this market a few years back, and they have 80 diagnostic center and 5 hospitals they've already opened, and they plan to open more. Columbia Asia Group from India is planning to open a hospital. The bank, Equity Bank, which is one of the renowned bank into the country, they have opened in addition to the banking sector now into a healthcare sector. So you can understand and you can realize yourself that the financial house is now entering into the healthcare business. Equity Afia plans to open 300 outreach centers in next few years into this country. Eva Care Group from abroad has bought 4 major hospitals into the country. Nairobi Women Hospital, Avenue Metropolitan, and Lebanon Hospital. Avenue Healthcare has also received $30 million funds from IFC for the expansion of their facility. Interesting thing, just in the last 2 or 3 years, you will see the biggest importer into the region. And my colleagues Priscilla and Dr. Kochula can also add here. Surgifarm has been acquired by Imperial Logistics from South Africa. So Imperial Logistics, Healthcare Logistics has a big facility in East Africa, and they have also now been bought over recently a few months back by DP World Dubai. So the companies from Dubai, South Africa are entering and investing heavily by even buying out the major distributors into the country. The second change that happened just a few months back, that Mauritius IBL Group has acquired a biggest, again, second or third biggest pharmaceutical distributor, Harde's, and they are now present here. So a lot of investors are coming and even buying out the biggest pharmaceutical distributor into the country and investing here. Shifa Pan African Hospital has set up the base in Tanzania with a hospital of a capacity of 250 bed. Apollo Hospital is also entered into the Tanzania by signing the MOU with Eclipse Group to open the cancer center. Mediheal Africa Hospital has been given a land of 7 acres in Uganda to build 350 bed hospital. Another hospital, Lobova, specialized hospital. It's a government specialized hospital in Uganda, has expanded to 250 64 bed, and it will be open in next year. So in conclusion from my side, to the Singapore based medical equipment, medical consumable supplier, that there is plenty of opportunity into this market. I am based out of Kenya, East Africa market for the last 15 years, and uh, believe you me, I have not heard of very good Singapore company. So that means I am not aware. So market is not aware of Singapore-based medical equipment, consumable manufacturers. That are there any good manufacturers except for one or two? So there is a potential to explore the Singapore market. There is a potential for Singapore companies to enter into this market and be part of this expansion. And as I mentioned that to improve the support level, to improve the services level, to improve the training level, to bring more variety into this market of good quality. So I think it will also be good for Singapore companies to get in touch with us, ask questions to us. We are here to support them and to guide them that what is the protocol to register your product, to enter into this market. And maybe if there are exhibitions, medical exhibitions are happening, or you want to arrange some private visit for us to visit some of the good factories who are manufacturing the healthcare product, we will be very much willing to explore Singapore market. So I think with that note, I just want to conclude and say thank you. If there are any question, I'm happy to answer those.
Thank you so much. I mean, that was really, really insightful. I'm sure, people are already having thoughts running through their heads, questions coming in. Remember to just capture them on the chat so that we're able to pick those questions up. So I think I'm just gonna, one moment. I think we'll move into our panel session. First, of course, really, really thanking Amin once again for the beautiful presentation. So we'll move to the panel discussion. So allow me to kindly introduce our rich panel of speakers today. Of course, we've already met Amin. Like I said, he's in charge of the purchase and supply within the Aga Khan University and Aga Khan Hospital Services. With us, we also have Ms. Priscilla Mohio. She's the country manager of MyDawa. She's a seasoned business leader, over 15 years of experience, 11 of which have been within the tech industry. Previously worked for Global, Sandy, OLX. So you can see she's very techy within that space and startup, and therefore has the grit towards such startups. She has a keen interest in leveraging technology and innovation to solve Africa problems. I'm going to request you, Priscilla, first, thank you so much for accepting to be a panelist. Please introduce, maybe 1-2 minutes, introduce to us who is MyDawa.
Good morning or good afternoon, everyone. My name is Priscilla Mohio, and country director for MyDawa. And I'm honored to be here today to share with you any insights that I may have learned along the way. Sorry. And so I would like to introduce MyDawa. MyDawa is the leading e-pharmacy here in Kenya. We started off in 2016, and when we started off, we had a couple of challenges in the first few years of the business because there's no really any regulation around e-pharmacy. So what we've had to do is together work with the PPB, or the Pharmacy and Poisons Board. Excuse me. Work together with the pharmacy board so that at least we can come up with a guideline that makes sense for the business and also for the consumers. So during COVID, our business really grew, and also we got some funding from AAIC. Hiroki is here, he was part of that. And we've seen our business grow, and also we've seen other opportunities. For example, right now we have telehealth capability, so you're able to book a consultation and speak to a doctor, and then once a prescription is written, the rider or the pharmtech rider is able to deliver the drugs to you. So we've been able to develop the telehealth capability in conjunction with the Bill and Melinda Gates Foundation. They funded us with the aim of creating an online journey for delivery of PrEP and PEP medications. That's the HIV prevention medication. And since then, we've been able to also onboard other patients who are interested in having a telehealth consultation. We also have a business arm, the wholesale business arm. And this is because we have our own drugs, generic drugs, branded Maidawa, and we manufacture them in India currently. And then they are all registered here in Kenya. So we have about 18 products that we have as Maidawa branded products. And we supply these products to hospitals, to retail pharmacies, and also sell through our platform. So in general, Maidawa is a pharmacy, of course, but we are now more than just a pharmacy because we now have telehealth capability, and we also have a wholesale business where we sell branded generic drugs.
Thanks, Priscilla. Thank you so much. Our next panelist is Hiroki-san. Mr. Hiroki Ishida is a director of AIC Partners Africa. He's a seasoned investment professional with over 10 years of experience specializing in healthcare and innovation sectors in Africa. Hiroki-san, thank you so much for joining us for this discussion. Maybe you can give us a feel of who is AIC, just an introduction, 1 to 2 minutes, please.
Good afternoon, my name is Hiroki. Thanks for the introduction. I am Japanese, but I'm based out of Kenya since 2015 and doing investment in the healthcare sector since that period. And also our fund is a venture capital focused on the healthcare sector in Africa. We have a headquarters in Singapore, so today we have some relationship and in Bangkok and Singapore. And we are managing 2 funds, over 65 million US dollars, and have over 40 portfolio companies across this continent. Today, I want to focus on more East African countries, and but also we are Pan-African country investment fund, and happy to share my experience and thoughts. And thank you very much.
Thank you, Hiroki-san. We also have Dr. Kochola. Dr. Kochola, I'd say, is a seasoned pharmacist. In fact, when I met him and we engaged, he said he's a senior in the pharmacy space, but definitely much junior in the world space. So he's the founder and MD of Arachis Pharmaceuticals and co-founder and MD of Garnet Pharmacy. He's a member of Pharmaceutical Society of Kenya and Kenya Pharmaceutical Distributor Association, passionate about pharmacy and healthcare supply chain solutions, and has over 13 years of comprehensive experience in the sector. Dr. Kochola, thank you so much for joining us in this panel. Please tell us, who is Arachi, who is Garnet, how does that work? Just want to get to know a bit about that team. 1 to 2 minutes, please.
Thank you, panelists. And it's a wholesome pleasure to meet you this bright morning in Nairobi. Again, I'm Dr. Kochola Waloho. I'm a pharmacist by profession with over 13 years experience in the pharmaceutical industry, having a specialist experience in supply chain management that involves the whole spectrum of importing, distributing, exporting a health commodity being pharmaceuticals, non-pharmaceuticals like gloves, medical equipment, medical devices. So all such commodities that are used in delivering healthcare outcomes. We run 2 companies. One is a supply chain company that deals in importation, distribution, and export of health commodities. That's by the name Arachis Pharmaceuticals. And we also run Garnet Pharmacy Limited, which is a community pharmacy or a retail pharmacy. With the largest single store pharmacy in Nairobi, and at the moment in high gears to expand within Kenya and across the region. The 2 companies control an annual turnover of about $8 million US, And as such, we are we hold a significant shareholding in the healthcare industry in Kenya and East African community region as a whole. Uh, 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 I'll leave it as such, as we'll discuss further about what our industry has in store for the Singapore investors who would want to be part of this successful business community region.
Okay, thank you so much, Dr. Kochola. I think I'm going to make a request. We will need to exit in about 10 minutes. So if you don't mind, I can see you've already started responding to some of the questions asked on chat. So even as you look at, even as we pick up the ones on chat, I want to just pick up a few that we would want to just get a feel of insights from you. Just want to understand from a health care point of view, how do hospitals do their procurement? And I know you mentioned that there's quite a bit of products not locally manufactured. So maybe just a feel from yourself on the product side. How much of this do you get from outside, and how much of it is sourced from the local manufacturing space? Just want to hear about the procurement space from a healthcare point of view. Amin.
Okay, so thank you, and I think it will be unfair if I just answer this question and not ask my gurus, my colleagues, Dr. Kochula and Priscilla, to add and correct. Then I think in Kenya and East Africa, there is tremendous amount of opportunity for healthcare manufacturers to enter. I would say over 90% of the healthcare products are still coming from abroad. And please correct me, my colleagues. You are into the same field. I would even say 95% are coming from abroad, which include Europe, America, China, India, Turkey, Pakistan. These are the countries who are exporting into the East Africa market. I see the IP plants. I see some basic pharmaceutical. I see basic gowns companies are entering into Kenya manufacturing side, but it is still not enough. I would say that they are covering maybe 5%. So 95% is the gap that can be fulfilled, and I would say all 95% cancer product is not easy to be produced into the country in short term basis. So I think there is need, there is demand for let's say the cotton products, the gowns, the the cotton wool, the bandages. Those are the basic things. Why can't Kenya, Tanzania, Uganda produce these countries? To start with, Kenya can produce, and I'm sure in Singapore there are those expertise available, and they need to come and see the market in terms of the government collaboration. And I'm sure government are very welcoming into these countries to invite the investor, and for us it will be good to have those companies coming into these countries.
Thanks, Eric, for coming. You alluded to the fact that there has been a lot of, I'd say, patients going into India, to South Africa to look to get, I'd call it secondary kind of support. But there was a bit of interruption during the COVID period, and there was a feeling that with that interruption, now economies are looking to develop the kind of skills internally. So like you correctly mentioned, you have expanded your cancer unit. Are we seeing a similar trend in the general healthcare space? Are we seeing healthcare providers looking to specialize in kidney probably issues or diabetes, such things? Is that a trend we are seeing, and from your opinion, expect to see going forward?
I think it does. And I think that COVID has been an eye opener to the world and and it has given a due attention to the regulator, to the people, that healthcare is something which can really chaos the world, and especially the healthcare supply chain. So every country now is looking into that. Okay, so what happened in COVID? in COVID, countries who are producing, exporting, put a ban on the export. So now those countries who are importing, what do? They had no option but to now do a 911 kind of production of a mask. I mean, I would quote the example of Tanzania, where the masks were not being produced. In Kenya, it was still being produced. Tanzania had to do a overnight bringing the machine and start producing the mask, but that is not enough. I think, and I just did another conference and where the people were there from all the different industry, and they were from procurement, and they were all excited to announce that they have done 100% P2P with their manufacturers. They have done 100% just in time for their manufacturers. They have done 100% credit payment term with their supplier. And when they asked me that what innovation, this kind of thing you have done in your industry, I told those my colleagues that with due respect, how many suppliers are you talking about? How many products are you talking about? And they say, we are talking about 300 products. We are talking about 5 suppliers. I say, in healthcare, we have 20,000 items and we have more than 1,000 vendors. So healthcare is very complex and very sensitive. If you don't have maybe a wheel or you don't have a tire, the automobile industry will maximum have a loss in the revenue. But if you don't have a stent and if you don't have a life-saving drug, somebody will die. So the quantum is completely different that, a Coca-Cola will have a loss in their sale, but here somebody will die if you don't have this thing. So these countries have a need. These countries are coming up with their this thing, but I think at a pace with which the demand is, we need some good manufacturers to enter into the country from even abroad.
Thanks, Amin. One very last one, a quick one, just a feel of what are those credit terms like? What's the usual credit terms in the industry? Just to give our listeners an appreciation of then what expectation would be there.
I would say that with the local suppliers, our terms are obviously credit because we are a reputable buyers. So the local companies provide us a term up to credit of 90. In some cases, a number of manufacturers abroad also provide us a credit terms, being a global importer and global organization. But a lot of our companies ask for LC or advance payment in some cases. So it ranges from different, but a majority of our purchases are on credit 90 days term.
Okay, great. Thank you. Thanks so much, Amin. I think we are slowly inching towards the time you need to exit. Thank you also for the response you've given to Tagol. At least they've gotten their response. And I think we're going to mention to the rest of, even as we allow you to leave, we want to thank you so much for the insights you've shared. And of course, we'll be reaching out to you from now, a point of view of the companies that are here with us from Singapore, and see how that journey can be followed up. So we allow you to leave painfully though, but wishing you all the best and a lovely day as you move on to the next appointment. Thanks, really appreciate it.
Thank you. Let me also type my my email and phone numbers for especially for Priscilla and Dr. Kochila, so that we can connect later on after the this thing.
Okay, great. Thanks. Maybe I want to jump to Dr. Kochola. Amin has given quite a good feel of from the healthcare side as well as on the procurement. There's quite a bit of information shared there. Just want to get a feel of what's probably just a feel at more drilling down to the pharmacy landscape from your eyes as a pharmacist.
Thank you so much, Amin, for the great presentation and for the connection as well. We really appreciate for the opportunity to meet you this morning. I'm going to share my screen. And if you can allow sharing of the screen.
one moment. I think you should have it. You've tried. You can't share. Just try share screen.
No.
Just one quick moment.
Yeah, it's okay now. So I want to take the whole team this morning, the Singaporean team and our colleagues, Kenyan team, about what the pharmaceutical industry in this region looks like. And this region, Kenya as a country, constitute about 1 billion in $1 billion US in pharmaceutical industry annually. Of this value, only 30% is met by the local manufacturers. There are quite a number of local manufacturing companies in Kenya. And to your surprise, they can only produce 30% of what the local market consumes. There has been a wide debate about how to expand this market, and I will really mention an area where Singapore investors need to focus much about. As Amina said, it's a growing market with immense business opportunities owing to the gaining interest of multinationals, big multinationals entering the local market, from diagnostic companies to pharmaceutical companies to companies that manufacture non-pharmaceuticals, all that. So there is a great future in this market, and increase in market share in pharmaceutical imports really present a big opportunity. Kenya is part of the COMESA free trade area agreement that consists of about 21 African member states with a population of about 640 million people. My research showed that Singapore has a population of about 6 million people. So it really, for Singapore investors, this would be really a good opportunity to enter into this region. Kenya appears to be the launch pad of most multinationals into this region, into the COMESA region, and into the East Africa Community Economic Bloc region, with about 312 million people. What does this region present in terms of pharmaceutical industry? High demand of goods, pharmaceutical commodities. We are talking about pharmaceuticals, non-pharmaceuticals, diagnostic equipment, laboratory equipment. The region also presents great labor potential in terms of affordable labor. Affordable labor is really a great asset when it comes to business expansion. And you've seen a lot of interest in capital for the region. with expansion of Kenyan banks into the East Africa Community region, talking about KCB Bank and Equity Bank. These are now the largest banks in the East Africa Community region. There is a lot of interest of also private equity capital seen from them acquiring major hospital chains, major pharmacy chains in the region, talking about Good Life Pharmacy that has changed hands a lot with private equity funds, international private equity funds. So there are two markets for pharmaceutical commodities or healthcare commodities in the private and public sectors. Who are the key industry players in this market? You are talking about wholesalers, direct importers. So these are local companies that imports directly from other markets. And they can be direct importers who give to their products to super distributors, who further then distribute to sub-distributors. And all these three players then supply retailers that include community pharmacy chains and independent pharmacies, hospitals like Aga Khan University Hospital, represented by Amin earlier. Then there are also local manufacturers, which I said satisfy about only 30% of the local market. Who regulates products in this market? As you know, pharmaceuticals or healthcare commodities are highly regulated, being that we largely serve humanity. And so the Ministry of Health, together with the Ministry of Industrialization, Trade and Enterprise Development, are the government bodies charged with regulation of entry of healthcare commodities and exit of healthcare commodities in the country and largely in the region. So in Kenya, Pharmacy and Poisons Board, the Kenya Pharmacy and Poisons Board is the healthcare commodities regulatory body that regulates pharmaceuticals, that regulates medical devices, medical equipment, and healthcare technologies. Kenya Bureau of Standards, KEBS, is also involved in borderline products like nutraceuticals, or in other terms, health supplements, and products, for example, cosmetic products, skincare products. Yeah. Then all these bodies largely borrow a lot of expertise from WHO through advice and certification standards. So World Health Organization is involved, especially in the regulation of the quality standards. So they will advise Pharmacy and Poisons Board of the standards required for high quality products, high quality regulation, high quality inspection of products. And then you will find also ISO is involved in also subscribing to the standards qualification. To supply some institutions, you would require actually WHO pre-qualification, but that's not entirely shared in the whole market. Products coming into the country must be registered. The registration process is simple, but can sometimes be long, especially where the exporting company and the importer do not clearly understand the regulatory requirements. There are quality control laboratories in Kenya, that is the National Quality Control Laboratory, and Mission for Essential Drug Supplies that are involved in further assessing the quality of products to be imported into the country. So this is the whole supply chain in Kenya. So the commodity types can be varied. In government supply chain, the commodity types can either be classified as essential drugs, medical equipment, and others. So all these are supplied by the government through a centralized store. Government usually put out tenders, annual tenders that can be open for international suppliers or can be restricted to local suppliers. Where the tender is international, the government require that local suppliers have 40% control stake in the whole business aspect or agreement of that business. So the government's procurement agency is called the Kenya Medical Supplies Authority. In brief, it abbreviated as KEMSA. And for medical equipment is the National Health Lab Services Store. So the government supplies to district hospitals, district hospitals. These are hospital denominations. We have national hospitals. We have national referral hospitals of various levels. Then you also have the private sector, and the private sector can be non-profit, for example, faith-based or religion-based healthcare institutions. And the main supplier for faith-based institutions is the Mission for Essential Drug Supplies. Then you have the other aspect of the private sector, which is for profit, like where now our company Arachis Pharmaceuticals fall. Are we all together?
Yes,
hello?
We can hear you.
Okay, great. It's good to confirm. Yeah. So the private sector where we fall in, where we supply medicine and all other medical commodities. So we have private importers and private manufacturers. So how does this work? I want to put it clearly that here is a Singaporean pharmaceutical manufacturer. Singaporean pharmaceutical manufacturer can either supply the Kenya's market directly. And when I talk about the Kenya's market, then it is by extension the East African Community market, and I will try to explain a little later. So can supply the Kenyan market directly, but will require that their products are registered, fully registered with the Kenya's regulatory body, which is the Pharmacy and Poisons Board. So in that case where they supply directly, then they will need to have a regional office in Kenya. The other aspect is where they have a local partner, and the local partner is usually termed as the local technical representative, the LTR. In that case, the LTR will handle all the regulatory process regarding the registration of the drugs, of the medicines into the local market, will handle the aspects of marketing, will handle the aspects of maybe branding, but the marketing authorization holding still remains with the Singaporean exporter or manufacturer. That is the same for pharmaceuticals. It is the same for non-pharmaceuticals, and it's also the same for medical equipment and medical devices. So what kind of market are we talking about that we are telling the Singaporean community that they can consider? Kenya government currently has competitive incentives for the pharmaceutical sector. One of the incentives currently running is for external manufacturers who want to manufacture the healthcare commodities here. The government has a lot of incentives that I'm sure the Enterprise Singapore community will share with you. And the current regime of government is particularly so focused in encouraging a lot of local manufacturing. Of the whole pharmaceutical sector, the local manufacturers are mainly into basic essential drugs. You are talking about basic antibiotics, basic antihypertensives. But where is the gap? There is less focus on immunological medicines. So if there are Singaporean companies that are involved in manufacture of vaccines, manufacture of critical care medicines, these are still largely being imported. Manufacture of anti-cancer or anti-cancer medicines. So these are areas which are not exploited currently. And with advice from the Enterprise Singapore, you will discover that there are a lot of opportunities awaiting Singaporean companies who would want to set up local manufacturing. You've seen at the capacity of the market in terms of Kenya only provides 64 million US dollars of export to the African market. The African market as it stands is about 13.6 billion US dollars in value. The Kenyan government is trying to, through an economic plan of Vision 2030, to increase this to 5%. That will be 678 million US dollars. Because of the ease of entry of Kenyan produced or Kenyan registered healthcare commodities into the East African Community region, and we shared earlier the population of this region, and also by extension the COMESA region.
Dr. Kochola, I'm going to make a special request so that we're able to get a feel of the other areas. If you could kindly just maybe, because if you're okay to share the slides, you could maybe give us the slides we share with the rest so that we also get a bit of touch on the other tech areas. That's okay, yeah?
Yes. Actually, that was my last slide. So I would be glad to receive further queries about detailed aspects of the pharmaceutical industry in the East African region, and I will share shortly our contacts.
Thanks, Doctor. So I think like we mentioned, any questions for Doctor, put them on the chat so that we can continue picking them as we have a feel of. I want to jump into Priscilla's world, Maidawa. So the online pharmacy phenomenon is relatively new, I'd say, in this region of ours. Just want to know, you've come in, realize these successes, what has given you that success? Maybe just a feel of the landscape of the online site and what you would attribute that success to.
Thank you, Anne. One thing that I would attribute the success to online is COVID, because prior to that, I would say people were skeptical about having medication delivered to them at the comfort of their homes. But during COVID, people were kind of forced to do that. So we saw more acceptance during that period, and that growth has continued on. However, one of our biggest categories is personal care and beauty and baby care. So we've seen a growth in these three categories because, as you know, medication unless you have a chronic disease, it has a lower frequency. So if you want to keep people engaged with the platform, you have to provide things that they will use more frequently. So we've seen the growth of personal care, beauty, and personal care, beauty, and baby care. One of the things that has set us up for success in Kenya in terms of online business is that we've seen growth in the smartphone access. The number of people who own smartphone has really increased. The other thing is that because of mobile money, it makes the payment of the products on either before delivery or on delivery easier. Because, for example, at Maidawa right now, you're able to pay on delivery using M-Pesa, and you can also pay prior to delivery using the same platform. So that has really had the growth of commerce and of e-commerce. And the other thing is we're becoming better and better when it comes to logistics. By that I mean, if you go around, you'll see a lot of motorbikes, you'll see a lot of what you call supply of logistics. It's now becoming more and more. And what we've seen is if we need to increase the number of riders we have on our platform, it's quite easy as opposed to before. So it's becoming a lucrative business for people, and they're joining the platforms. And the other thing is also the fact that we've had a lot of education. I've been privileged to work through the pioneers of e-commerce in Kenya. I worked for a company called OLX, the first online classifieds. At the beginning, it was a challenge because people did not understand how you can sell anything online. And we had to do a bit of education and a bit of encouraging people to change their behavior. And it's the hardest thing, and you have to spend a lot of money. But we've seen that paying off now, because now people are embracing using online platforms to do business. So that the inception or the companies that are e-commerce based coming into Kenya, it kind of helps spur growth, because now people are becoming more and more educated when it comes to using online platforms. So yes, we are set up for success, and maybe I can mention a couple of opportunities that that are there in Maidawa if you were to work with Maidawa. I mentioned earlier that we have our own branded drugs. So what happens is that we manufacture them in in India, and the reason for this is because of costs. And these costs are mainly driven by their accessibility to APIs. I am not sure, but I think I stand to be corrected. There is no API manufacturer in Africa, or most of the API manufacturers are either based in India or China. So it makes it a bit difficult to get cost-effective medication in Africa. So yes, they are local manufacturers, and but the costs are so high that it doesn't help us reduce the cost to the consumer. So we are very open to having conversations with manufacturers who can help us either maintain or lower the cost. The biggest challenge with India currently is the fact that the lead times are very long, take about 3 months before the products come here to Kenya. So if we can find ways of reducing these lead times by working with the manufacturers who are closer, that would be ideal. And the other opportunities I see are around personal care, baby care. We've had very good success with launching new beauty products. A case study I can provide is La Roche-Posay. When they came to Kenya, we did a very sampling. Can you hear me? I disappeared for a second. Sorry, I'm tittering with my phone. That's why I got a call. Sorry about that. Now I'm back. Okay. Okay. So I was talking about La Roche-Posay. We launched in Kenya, and now they are our #1 brand in the platform. And we did a very interesting launch plan. We did a bit of sampling. So for every order that was going out, we had a bit of sampling of the new products that they had. And they are now literally #1 brand that in my Dawa, that we sell in my Dawa. And what we can do is, if you have new products, especially around the beauty, personal care, and baby care, we are more than happy to partner to even test whether there's market acceptance of your product. So if you come in, we do a launch plan, and together we work towards launching the brand in the market. The other thing is around supplements. Since COVID, actually, we've seen that supplements uptake has really gone up. Even talking about myself, since the COVID period, I'm very keen on making sure I'm taking my vitamins, I'm taking my Well Woman Plus ETC, my Omegas ETC. So we've seen a very good growth in supplements, and we expect this to continue growing. So anyone out there who is interested in launching any supplements in the market, we are more than happy to partner to test the market. You know, the good thing about online testing with an online platform is that over and above the fact that we offer convenience, we will be able to get data immediately to see whether it's possible, or rather there's market interest, because of the fact that we are online. So we're able to get data almost immediately. So those are the opportunities I see, and I'm more than happy to have conversations. Please feel free to share my details with the team. Anyone who's interested in launching anything in the market and they feel we can be a good partner, I'm more than happy to have those conversations. Yeah.
Thank you. Thanks so much, Priscilla. Nice, insightful. Thank you so much. I want to ask, with regards to the online procurement, are you able to see a trend? Is there a trend? Like, is it older guys, middle guys, age-wise, region-wise? Who are your clients online?
It's interesting. We've seen the woman is. We're actually calling her the chief health officer of the family. This is because I think also it's because of the fact that we have an array of women products. When you think about personal care, it's mainly around women. Baby care, a woman is the one who is likely to buy these products, and then beauty. But also when it comes to other things, like even supplements, taking care of the family, the woman is the one who tends to make this decision. So even in terms of defining who our core target audience is, we define the woman who's aged between 25 and 45 as our core target audience. And then everyone else is, it's in the, in the periphery. But interestingly, when it comes to telehealth, I mentioned before that we have telehealth services. We do about 1,000 consultations a month. We'll see most of them are male. And this is simply because of the fact that men tend, especially when you're talking about STIs, sexually transmitted diseases, you tend to want to have a private conversation as opposed to going to a clinic and having that conversation face to face. So we're seeing most of the people who are coming to us, especially on STIs, they're mostly male. So it depends in the category, but in terms of our core market, our core target audience, we mainly focus on the woman, aged between 25 and 45.
Okay, that's really clear. Any idea at an industry level of the percentage of online purchases in, let's even lose in Kenya?
It's quite low still. And I think the reason why it's quite low is because no one is tracking the commerce that's happening on social media. There's a lot of commerce that happens on social media. There's a lot of Instagram pages selling stuff. I think if we consolidate all that, the percentage would be much higher. I don't think it's more than 10%. Just hypothetically, and even for pharma, it's much lower. But I think it's because we are not tracking the commerce that happens on WhatsApp, happens on Instagram, happens on Facebook. I can tell you, we buy a lot of things on social media. Myself, I buy a lot of hair, everything I need. Sometimes I just get it from social media, and I don't think we incorporate that into the numbers. But yeah, it's quite low still. We have barely scratched the surface. But the good thing is that, as you know, we are a young population. We are seeing more people will join the addressable market soon. So I expect this market to really grow. We barely scratched the surface.
Okay. Thanks, Priscilla. Then maybe just, I'm aware my dad recently acquired a pharmacy in Uganda and a pharmacy chain. Might this be a reflection of the expected growth on that side, like discussed with expansion? And are you able to give just a feel of what kind of products are being requested from Uganda, and is that the same that's happening in Kenya? What's that comparison like?
To be honest with you, we've just acquired them, like you said, so I don't have that insight. And maybe I can explain the reason why we have decided to go that way. Maybe something else I didn't mention, we have a retail pharmacy in Mombasa, branded My Dawa Pharmacy. But what we've seen is that when we launched Mombasa early this year, when we started off, we had like 90% of the traffic coming from, or rather the revenue coming from walk-ins. But when we started doing digital marketing campaigns, pushing our brand online, we've now seen 60-40, where 60% is walk-in, 40% is online. So what does that tell us? With an online pharmacy embedded onto a retail pharmacy, it increases the service area. So ideally for a walk-in pharmacy, you probably serve maybe 5 kilometers away from the pharmacy. But if we embed an online pharmacy on top, you're able to serve a bigger radius because people can order at the comfort of their homes. So this is an interesting hypothesis, and that's the same learnings we are going to take to Uganda, where we overlay our online capability onto the existing retail pharmacy, and we expect this to also spark growth in Uganda. But in terms of what's selling and what's not selling, I'm not quite, I don't have that insight yet. Yeah.
That's okay, Priscilla. Well understood. Thank you. You mentioned we might have to lose you in the next 1 minute. So thank you so much for
1 minute.
sharing us. And I think we really appreciate and wish you a good day after this. We'll definitely be reaching out to you after this, and we'll share your contact with the team, with the Singapore companies that are here with us, so that we can also continue this discussion from here. Thanks so much.
Okay. Really, thank you so much, and I appreciate the opportunity.
Thanks. Okay.
Thank you.
Bye-bye. Dr. Kochola. Bye, Priscilla. Dr. Kochola, I'm sorry, I think I'll jump over to Hiroki, one of the investors in My Dawa. So the thing about this region is many companies looking to come and invest in the tech or startup space are mocking towards fintech and all that. Why health tech for AAIC? Just want to understand the genesis behind the thinking of starting on healthcare side and focusing on healthcare.
Great, thanks for the question. I can mention 2 points. Number one, the macroeconomics. So first, healthcare has a lot of challenges and issues in this continent, and especially maybe compared to the more developed countries such as Singapore or Japan, Africa, we are missing a lot of infrastructure, both hard and soft, and which, for example, we don't have enough number of pharmacies, also hospital clinics, and say doctors. We have only 0.2 doctors per 1,000 population, and as opposed to 2.5 that's Singapore. And then, but it's not possible to have so many doctors. It takes time, and to develop some more like facilities. Also, it's gonna take time and cost. Then what we can do is we can utilize the technology so that we can empower the existing facility and utilize those infrastructure. And then, so which means the pain is very strong, and there are a lot of space technology can play a significant role. That's why people are keen on how they can utilize the technology. Also, investors are keen on investing in this continent. As Priscilla mentioned, so yeah, that's something. One of the reasons we are keen on the healthcare, especially after COVID-19. Although we are doing investment before COVID-19, but it kind of forced people to change their behavior. And then number two, our investors, we are the fund, so we also have the investors, and most of actually Japanese corporate in the healthcare sector, maybe similar with today's audience, such as maker of catheter endoscopies, also pharmaceutical company like Eisai, sixth largest pharmaceutical company in Japan. Also, hospital management company that manage over 5,000 beds in Japan. They are quite keen on how they can expand their business or start their business in Africa, but the challenge is limited information. Also, try to find the right partners. That's kind of a challenge. That's why they invested in our fund, and then also we invested in the hospital, clinic, startup companies, and then trying to provide information and also provide opportunity to do co-investment. That's why we focus on this space. Yes.
Thanks, Hiroki. So, of course, Baidawa is one of the successful runs that you have. Any other pointers on the success journeys for probably investors who are looking to get in the industry? What other successes have you seen within the health tech startup space?
Yeah, I think that healthcare platform is quite common, like Kenya, Nigeria, Egypt, South Africa. We can access telemedicine, pharmaceutical delivery, and pharmaceutical distribution is one of the key area for us. But already Dr. Kochura Priscilla mentioned about that, so maybe I can talk about maybe insurance. The insurance penetration rate is very low in this country. Like Kenya, 20% public, but 2 to 3% private. But this is relatively higher compared to other countries in Africa. Then the challenge is how we can cover those people who are not afford to pay their premium every month. But recently we see a lot of startup company providing insurance, which allow them to pay maybe monthly for someone who cannot pay at once for annual fee. But then question is how they can minimize the cost if they decrease the premium. That also they have a limited amount. But they combine the technology using technology of telemedicine so that they ask the members to make a call first instead of visiting the clinic, hospital. Then, as maybe you can imagine, most of the people, maybe 60% or 70%, they don't see the doctor in person. Just look like an advice. Okay, maybe you can take this medication for a week. Then, if you are still feeling bad, you can come to maybe visit the hospital. So that's how they can minimize the cost. And then now they are providing the more services. And one of our portal company called Reliance Health, they became the second largest insurance company in Nigeria after several years. So what I can say is maybe startup company can utilize have some focus, then also can add some function, like Maida started the pharmaceutical delivery, but now they can also provide telemedicine services.
Wow, quite informative. Is there any no-go, like you've seen a failure and you're like, this is not an area you'd want our Singapore companies to consider? Areas of challenges or areas you'd say don't touch that side?
There's no area that we are not supposed to touch, and it is an area that people hesitate to touch. Maybe there must be some opportunities, but maybe it's a bit difficult for the company from Singapore to do big business, but maybe that was the way to find the right partner, like maybe Dr. Kochola, also Maidawa, to access the people already, because they have a good network in this continent. But the important thing is to find the right partner. Also, I do advise to the Japanese manufacturer how they can find the right distributor, and some of them are struggling to sell their product, but they have a distributor, but though they don't provide the correct information, just keep saying, okay, the market is not good, but the reality is not, maybe sometimes they are not spending enough effort to selling the product. So I think I'm just so enterprise Singapore can support that kind of process, but my advice is to find the right partner first.
Okay, great. Thanks, Hiroki. I'm going to ask Dr. Kochola. We understand that a product can only have one agent or distributor at a time. Is that the situation? Just trying to pick from the discussion that Hiroki has mentioned about getting the right distributor on the ground. Is that how is that dynamism around? Can I have exclusivity? Can I be the only agent? What's that environment like?
Healthcare commodities are intellectual properties. That means for every brand, it can only have one agent. However, a brand is not a molecule. If you are talking about paracetamol, paracetamol is a molecule. So if a company is producing paracetamol under different brands, maybe one brand is called Panadol, another brand is called Tylenol, then the two brands can have different agents. However, as well, some agents would want to request for exclusivity, both for the brand and for the molecule produced by one particular manufacturer. This is to really protect their market share, because as you understand, or as you will be made aware here, is that the process of registration is extensive and sometimes costly. So you would want to maintain exclusivity both for the brand and for the molecule to protect the market share of the agent and reduce competition. Yes, I hope I'm clear. So it is possible for a molecule to have more than one agent, but a brand will only have one agent, because a brand is registered under the agent. The agent in this case is the local technical representative. That's the term used internationally for agents.
Thanks, Doctor. That's very clear. Wanted to just find out that Kenya is seen as a hub for many things. Technology and health is one of them. I just wanted to find out, is there any advantage of having a product registered in Kenya in its journey towards the East African expansion? Any advantages, any value in considering, let me bring it into Kenya?
Mr. Hiroki will support this through his experience in the region, that Kenya is the business hub for the East Africa Community region, and by extension, strongly encroaching into the COMESA region. A product that is already registered in Kenya has a higher appeal in the East Africa Community region. Also, the regulatory authorities in the other East Africa Community regions find it easier to register products that are already registered in Kenya. Just the same way to extrapolate this internationally, if you have a product that is already registered by Food and Drugs Authority in the USA Food and Drugs Authority, because of the quality of certification of that regulatory body, it becomes easier to register it in another market because of the quality certification standards of that body. So yes, Kenya is the head boy of is the head boy, the economic head boy of East Africa community markets. Just to give further examples about Kenyan banks, banks which are domiciled in Kenya, Equity Bank with the largest asset base in East Africa Community Region, KCB Bank with, I think, the second largest asset base in East African Community Region. You have now Kenyan banks being the top banks in other markets like DRC, Congo. You have Kenyan banks becoming top banks in Rwanda and other markets. You've seen technology firms like Safaricom getting into other bigger markets of COMESA like Ethiopian market. So yes, Kenya is by extension the economic head boy of, or head girl, just to be gender sensitive, of East Africa community markets.
Okay, thanks, Doctor. To everyone here, there's so much more we have wanted to engage just to get insights from, Hiroki-san, Dr. Kotola, and the other team that has left. Unfortunately, time has already overrun. So I think I'm going to pause over here. Give us a few minutes, see whether we might have a few more questions from our Singapore companies. I know that the few that had already been put on the chat have been responded to. We'll give it a few minutes, just see whether we might get a few questions from so if we don't get any, we'll just probably, since we'll be able to share, allow me to just share the team that then our Singapore companies can reach out to. Any of these, my regional director, Lynn, myself, and Lian, please feel free to reach out to us. Any questions, any areas you want to get clarification on, we will share the contacts of our panelists today, our rich panelists. Must say thank you so much, Doctor. The sharing you gave us, nice, deep, rich. Hiroki-san, thank you so much. In absentia, Priscilla and Mr. Amin, really, really appreciate so much information. So much more would have gotten, but the time is a bit limited. So I think at this point, I'm going to thank all of you for being there. Just take one last minute of your time just to speak about, especially for the Singapore and even our panelists, about the Africa-Singapore Business Forum happening at the end of this month, 29th, 30th, 31st in Singapore. It's actually, it's organized by Enterprise Singapore. It's a business forum that brings African companies and Singapore companies together. Over the last iteration, we had to do it virtually because of COVID. Now we are back to physical, so it's in Singapore, and we look forward to having all the companies represented here at the event.